If you've ever been referred to a specialist and had absolutely no idea what that person actually does, you're not alone. Medicine has become so specialized that even doctors sometimes struggle to keep track of who does what. Today we're going to fix that. We're going through every major medical specialist, what they treat, why you'd see them, and what makes their job unique. Let's get into it. Primary care physician. Before we get to specialists, let's start at the beginning. Your primary care physician, or PCP. This is your general doctor. They're the first person you call when something feels off. They handle routine checkups, vaccinations, common illnesses, and they're the ones who decide when you actually need a specialist. Think of them as the quarterback of your healthcare. They don't do everything, but they direct the whole operation. Cardiologist. Next up, the cardiologist. These are the heart doctors. If you have chest pain, high blood pressure, an irregular heartbeat, or a family history of heart disease, your doctor will send you to a cardiologist. They interpret ECGs, those squiggly line printouts that show your heart's electrical activity, and they perform stress tests to see how your heart handles exertion. Some cardiologists also perform procedures like inserting stents into blocked arteries or implanting pacemakers. Your heart beats about 100,000 times a day, and cardiologists are the ones making sure it keeps doing that. Pulmonologist. The pulmonologist handles everything below your neck and above your stomach, specifically your lungs and your breathing. Asthma, chronic obstructive pulmonary disease, pneumonia, sleep apnea, pulmonary fibrosis, these all fall under their territory. If you're short of breath and it doesn't go away, a pulmonologist is who you'll end up seeing. They often work closely with cardiologists because the heart and lungs are tightly connected. When one struggles, the other usually does too. The gastroenterologist. The gastroenterologist, or GI doctor, is the specialist for everything along your digestive tract. That means the esophagus, stomach, small intestine, large intestine, liver, gallbladder, and pancreas. If you have heartburn that won't quit, stomach ulcers, irritable bowel syndrome, Crohn's disease, or if you've noticed blood in your stool, a gastroenterologist is your person. They're also the ones who perform colonoscopies, which, yes, everyone over 50 is supposed to get. It's not glamorous, but it saves lives. Hepatologist. Hepatologists are a subspecialty within gastroenterology focused almost exclusively on the liver, gallbladder, and bile ducts. If a GI doctor finds serious liver disease like cirrhosis, hepatitis B or C, or fatty liver disease progressing toward failure, they'll often refer you to a hepatologist. These doctors also manage patients waiting for liver transplants and oversee care after transplantation. Endocrinologist. The endocrine system is your body's hormonal network, a collection of glands that secrete hormones to regulate everything from metabolism to mood to reproduction. Endocrinologists are the doctors who specialize in this system. Diabetes is the most common reason people see an endocrinologist, but they also treat thyroid disorders like hypothyroidism and hyperthyroidism, adrenal gland problems, growth disorders, and conditions like polycystic ovary syndrome. Basically, if your hormones are misbehaving, this is your doctor. Nephrologist. Your kidneys filter about 200 liters of blood every single day. When they start to fail, it's a big problem, and that's where the nephrologist comes in. Nephrologists treat chronic kidney disease, kidney inflammation, electrolyte disorders, and high blood pressure that's hard to control. They also manage patients on dialysis, the machine that takes over kidney function when the kidneys can no longer do it themselves. They don't perform kidney transplants, that's a transplant surgeon, but nephrologists care for patients before and after the procedure. Urologist. Urologists are often confused with nephrologists, but the distinction matters. Nephrologists treat kidney disease medically. Urologists treat urinary tract problems surgically and procedurally, and in men, they also handle reproductive issues. Kidney stones, urinary tract infections that keep coming back, bladder problems, prostate disease, and erectile dysfunction all fall under urology. For men, the urologist is often the equivalent of the gynecologist, the specialist you see for reproductive and urinary health. Neurologist. The brain, spinal cord, and all the nerves that extend from them, that's the domain of the neurologist. They treat migraines, epilepsy, multiple sclerosis, Parkinson's disease, stroke, and neuropathy. If you suddenly lose feeling in your arm, have a seizure, or develop a tremor, you're heading to neurology. Neurologists are diagnosticians at heart. Many neurological conditions are identified through detailed exams, imaging, and nerve conduction studies, rather than simple blood tests. Neurosurgeon. The neurosurgeon is what happens when a neurological problem requires surgery. Brain tumors, ruptured discs in the spine, severe epilepsy that doesn't respond to medication, burst blood vessels in the brain. These cases go to the neurosurgeon. This is one of the longest and most demanding training pathways in all of medicine, often taking over a decade after medical school. Psychiatrist. A psychiatrist is a medical doctor who specializes in mental health. Because they have a medical degree, they can prescribe medication which distinguishes them from psychologists and therapists. Depression, anxiety, bipolar disorder, schizophrenia, post-traumatic stress disorder, and eating disorders are among the many conditions they treat. Some psychiatrists also provide talk therapy, though many focus primarily on medication management and work in tandem with therapists. Orthopedic surgeon. Your bones, joints, tendons, ligaments, and muscles. The orthopedic surgeon is the one who fixes them when they break down. Broken bones, torn, anterior cruciate ligament, rotator cuff injuries, hip replacements, spinal fusions. Orthopedics covers all of it. Athletes often have close relationships with orthopedic surgeons. As the population ages, hip and knee replacements have become some of the most common surgeries performed worldwide. Rheumatologist. If orthopedic surgeons fix structural problems with bones and joints, rheumatologists treat the inflammatory and autoimmune diseases that attack them. Rheumatoid arthritis, lupus, gout, psoriatic arthritis, ankylosing spondylitis. These are all rheumatological conditions. The body's immune system essentially turns on its own joints and tissues, causing pain, swelling, and damage over time. Rheumatologists use medications that calm the immune system to slow this process. Dermatologist. The skin is the body's largest organ, and the dermatologist specializes in it, along with hair and nails. They treat acne, eczema, psoriasis, rosacea, and fungal infections. Most critically, they screen for and treat skin cancers, including melanoma, which can be deadly if caught late. A dermatologist can also perform biopsies on suspicious moles and remove benign growths. For many people, the dermatologist is someone they should see annually, the same way they see a dentist. The ophthalmologist is the full medical doctor for your eyes. They can prescribe glasses or contacts like an optometrist, but they go much further, treating glaucoma, cataracts, macular degeneration, diabetic retinopathy, and performing eye surgery. If you have a medical condition that affects your vision like diabetes or high blood pressure, regular visits to an ophthalmologist are important. They're also the ones who perform LASIK and other corrective surgeries. ENT stands for ears, nose, and throat, and that's exactly what these doctors specialize in. The formal name is otolaryngologist, which is a word most people just give up trying to pronounce. They treat hearing loss, chronic sinus infections, nasal polyps, tonsil problems, voice disorders, and balance issues. They also screen for head and neck cancers. If you've had ear infections your whole life, struggled with snoring, or lost your voice for weeks at a time, this is your doctor. These specialists handle the immune system's overreactions and deficiencies. Allergists treat hay fever, food allergies, asthma triggered by allergens, hives, and anaphylaxis, that severe, life-threatening allergic reaction. Immunologists focus on immune deficiency disorders, conditions where the immune system is too weak to fight infections properly. In practice, many physicians hold both specializations and see patients for the full range of immune-related conditions. The hematologist studies and treats disorders of the red blood cells, white blood cells, platelets, and the bone marrow that produces them all. Anemia, clotting disorders like hemophilia, bleeding conditions, and blood cancers like leukemia and lymphoma all fall under hematology. Because blood cancers overlap heavily with oncology, many hematologists are also trained oncologists. Oncologists treat cancer. The field is divided into three major branches. Medical oncologists use chemotherapy, immunotherapy, targeted therapy, and hormone therapy. Radiation oncologists use focused beams of radiation to destroy tumors. Surgical oncologists remove tumors through surgery. For most cancer patients, care involves a team from all three specialties working together to determine the best course of action. Gynecologist and obstetrician is a combined specialty, but the two sides are distinct. The gynecologist manages the female reproductive system menstrual disorders, fibroids, ovarian cysts, pelvic pain, sexually transmitted infections, and menopause. The obstetrician manages pregnancy and childbirth. Many physicians do both, providing care from a woman's teenage years through the end of life. Gynecologists also screen for cervical and ovarian cancer and perform procedures like hysterectomies. Sometimes called a perinatologist, this is the high-risk pregnancy specialist. If a pregnancy involves twins or triplets, a fetus with a detected abnormality, a mother with a serious health condition like diabetes or heart disease, or complications like preeclampsia, the maternal fetal medicine specialist steps in alongside the OB. They perform detailed fetal ultrasounds, interpret genetic testing, and sometimes perform in utero procedures to treat conditions before birth. This specialist sits at the intersection of endocrinology and gynecology, focusing specifically on fertility and hormonal conditions that affect reproduction. If a couple is struggling to conceive, they will likely end up here. Reproductive endocrinologists oversee treatments like IUI intrauterine insemination and IVF in vitro fertilization. They also treat hormonal conditions like polycystic ovary syndrome in the context of fertility planning. Neonatologists care for newborns, but specifically newborns who are sick, premature, or born with complications. They work in the Neonatal Intensive Care Unit, or NICU. A baby born at 28 weeks weighing under 2 pounds needs a neonatologist's expertise to survive. These physicians manage immature lungs, fragile hearts, feeding difficulties, and infections in some of the smallest patients in any hospital. Once a baby leaves the NICU and goes home, their ongoing healthcare falls to the pediatrician. Pediatricians provide general medical care to children from birth through adolescence vaccinations, growth and development monitoring, common illnesses, and behavioral concerns. They're essentially the primary care physician for anyone under 18. Many pediatric conditions also have their own subspecialists, pediatric cardiologists, pediatric neurologists, pediatric oncologists who apply their expertise specifically to children. On the other end of the age spectrum is the geriatrician, a physician who specializes in the care of older adults, typically those over 65 with complex or multiple health conditions. Aging brings unique medical challenges, multiple medications that interact with each other, cognitive decline, falls and balance problems, frailty, and end-of-life planning. Geriatricians are trained to think about the whole picture rather than treating each condition in isolation, which is especially important when a patient has 7 different diagnoses and 10 different prescriptions. When an infection is unusual, severe, difficult to treat, or resistant to standard antibiotics, the infectious disease specialist is called in. They're experts in bacteria, viruses, fungi, and parasites. HIV and AIDS care is a major part of infectious disease medicine. They're also the physicians who investigate outbreaks, advise hospitals on infection control, and guide treatment of rare infections that most doctors never see. During the COVID-19 pandemic, infectious disease specialists became some of the most visible physicians in the world. Palliative care is often misunderstood as being the same as hospice. It isn't. Palliative care is specialized medical care focused on relieving the symptoms, pain, and stress of serious illness at any stage of that illness. A cancer patient can receive palliative care alongside aggressive chemotherapy. A person with heart failure can receive palliative care years before death. The goal isn't to cure the disease, it's to improve quality of life. Palliative care specialists are experts in pain management, difficult conversations, and helping patients and families make decisions that align with their values. Every time you go under general anesthesia for surgery, an anesthesiologist is keeping you alive. They calculate the precise medications needed to keep you unconscious, pain-free, and stable throughout a procedure. They monitor your breathing, heart rate, blood pressure, and oxygen levels continuously. They also provide regional anesthesia like epidurals during childbirth and manage pain in the ICU. Anesthesiology is one of those specialties that functions invisibly when everything goes right, which is exactly the goal. The emergency medicine physician is the specialist in acute, undifferentiated illness and injury. They're trained to stabilize patients across every possible condition: heart attacks, strokes, traumatic injuries, overdoses, severe infections, allergic reactions. They are not a replacement for specialists. Their job is to diagnose quickly, treat immediately, and determine what comes next. Emergency medicine requires breadth over depth, the ability to act decisively with incomplete information, under time pressure, on anyone who walks through the door. The intensivist is the specialist for the sickest patients in the hospital, those in the intensive care unit. When someone is on a ventilator, their organs are failing, or they're in septic shock, the intensivist manages their care. This is critical care medicine. Intensivists often work alongside specialists from every other field because when a patient is critically ill, every organ system may be involved. The intensivist's job is to manage all of that simultaneously and keep the patient alive. A relatively newer specialty, the hospitalist is a physician who works exclusively in the hospital managing admitted patients throughout their stay. In the past, your primary care doctor would follow you into the hospital. Today, most hospitals use dedicated hospitalists who know hospital medicine deeply, managing post-surgical complications, coordinating specialists, writing discharge plans, and ensuring continuity of care. They're the doctors who see you every morning on rounds. Radiologists are the doctors who interpret medical imaging X-rays, CT scans, MRIs, ultrasounds, and nuclear medicine scans. Most patients never meet their radiologist. They work largely behind the scenes, analyzing images and writing reports that other physicians use to make diagnoses. Interventional radiologists go a step further. They perform minimally invasive procedures guided by imaging, like draining fluid collections, placing stents, or delivering treatment directly to a tumor through blood vessels. The pathologist studies disease at the cellular and molecular level. When a surgeon removes a tumor, a biopsy, or an organ, it goes to the pathologist who examines it under a microscope and determines exactly what it is. Cancer diagnoses are ultimately confirmed by a pathologist. Forensic pathologists perform autopsies. Clinical pathologists oversee hospital laboratories and interpret lab results. Like radiologists, pathologists are largely invisible to patients, but essential to accurate diagnosis. Sports medicine physicians specialize in physical activity, fitness, and musculoskeletal injuries without necessarily being surgeons. Sprains, strains, stress fractures, concussions, and overuse injuries are their bread and butter. They work with amateur and professional athletes, but also with everyday people who want to stay active. Many are team physicians for sports organizations. They focus on getting people moving again as quickly and safely as possible. Often called physiatrists, these physicians specialize in restoring function and quality of life after injury, surgery, or illness. They manage spinal cord injuries, traumatic brain injuries, stroke recovery, and chronic pain syndromes. They don't perform surgery, they use physical therapy, occupational therapy, medications, and interventional procedures like injections to help patients regain as much function as possible. They're the specialists who see you after the acute medical crisis is over and the hard work of recovery begins. Chronic pain is one of the most common and debilitating conditions in medicine, and managing it is an entire specialty. Pain management specialists treat conditions like chronic back pain, nerve pain, fibromyalgia, and complex regional pain syndrome. They use a combination of medications, nerve blocks, spinal cord stimulators, and behavioral approaches. Because chronic pain is both physical and psychological, the best pain management is usually multidisciplinary. Plastic surgeons do far more than cosmetic procedures, though, that gets most of the attention. Reconstructive plastic surgeons rebuild what disease or injury is taken away. Breast reconstruction after mastectomy, facial reconstruction after burns or accidents, hand surgery after traumatic injuries, cleft palate repair in children. Cosmetic plastic surgeons focus on elective procedures, rhinoplasty, facelifts, liposuction, implants. Many plastic surgeons do both. Vascular surgeons operate on the blood vessels, arteries, and veins outside of the heart. Blocked arteries in the legs causing peripheral artery disease, aortic aneurysms, varicose veins, and carotid artery disease all fall under vascular surgery. They perform bypasses, angioplasties, stenting, and repairs of damaged vessels. The distinction from cardiac surgery is that vascular surgeons work on everything except the heart itself. The cardiac surgeon operates on the heart. Coronary artery bypass grafting, commonly called bypass surgery, is one of the most common cardiac procedures. Valve replacements, repair of congenital heart defects, and heart transplants are also within their scope. It's one of the most technically demanding surgical specialties, requiring extraordinary precision, while the heart is at least temporarily stopped. Modern medicine is not only built on doctors and specialists, it is also built on nurses. In fact, nurses are often the people who stay closest to the patient. Doctors may come in, examine, diagnose, prescribe, or perform a procedure, but nurses are there through the hours in between. They watch how the patient responds. They notice when breathing changes, when pain gets worse, when confusion begins, or when something feels wrong before it becomes obvious on a test. This is why nursing is not a small role inside medicine. It is one of the main systems that keeps healthcare moving. Emergency nurses work where every second matters. ICU nurses care for patients who may not survive without machines. Surgical nurses help make operations possible. Oncology nurses stay with patients through long cancer treatments. Pediatric and neonatal nurses care for children and newborns who cannot always explain what is wrong. So when we talk about medical specialties, nurses should not be placed outside the conversation. They are part of the same medical world, not as background support, but as professionals who turn treatment into real care. A hospital without specialists cannot diagnose everything, but a hospital without nurses cannot function at all. So these are the main medical specialists you may hear about. Each one focuses on a different part of medicine, from the heart and lungs to surgery, imaging, mental health, newborn care, and nursing. If you ever get referred to one of them, now you'll have a better idea of what they actually do. Thanks for watching.